Hi, I'm Dr. Natalie Cordova, and I'm going to show you a basic foam rolling routine. Now, all you need is a simple foam roller. You can easily pick that up from our office, or you can get one at Target or Academy. Really easy to get. You want something that's firm. They do make some that are soft, but you don't want something that's so soft that you don't have an effect on your body. So what we're starting with is the muscles of the calves. So I will start, and I put the foam roller in the middle of the muscle, so you're going behind the legs, and you're going to raise up your bottom, and then you're going to foam roll just a few inches one way, and then a few inches the other way. And then you can go a little bit longer, and then you go up and down. So you're trying to get deep pressure, and you're trying to find adhesions and tightness that you want to go away. So this one, I'm focusing on the calves, both the right and the left, and there's not a lot of weight on your lower legs as opposed to some of the other body parts. And so with the calves, as you foam roll those, you might notice that you can add a little more weight, crossing one leg over the other, and you'll have a little more pressure that way. If it is comfortable for you, go ahead and do that. And so you're just going up and down the length of that calf muscle. Now, when you want to get a little deeper, you can also go to the side of the calf muscle, both on the outside of the leg and the inside of the leg. You're really trying to find and target the adhesions that have built up over time, or that you've had injuries in the past, and you're trying to work those out. So I can feel a little more tightness closer to my ankle, and so I'll work that area there. So once you've done that for a few swipes, so you want to go up to the knees. The knees are very important because you're going to have the crossover from the lower leg muscles as well as the hamstrings. So you really want to work that, and sometimes it's very sensitive at first, and so you want to be careful and just do a few sweeps back and forth and then move on. If this feels really good and you have a lot of adhesions, keep going deeper. And then you want to move on to the hamstrings. So again, starting into the middle of the belly of the muscles, you're going up and down. And just a few sweeps back and forth for a few minutes, you really can feel the pressure go into the bone and telling your body to make a change of the fascia that's wrapped around your muscle. And so that should feel really good. Once you've done that a few times, then you want to work up to the glutes. And so there you want to move it again, and you're sitting on it. Now this one you have mostly bone right here, so then you want to go at a slight angle, and you're going to go back and forth, and you'll go at both the right side and the left side, but you want to work that glute so that you can feel where there's adhesions closer to the top of the iliac crest is the pelvis, or lower towards the femur. And so you want to get all of that thick muscle and really try to work it. Once I've done both the right and the left side, then I will move on to the low back. And again, positioning yourself in the right way. If there's any discomfort or you're not able to do these movements, then go ahead and ask your doctor how to do this in a different way, or don't do it yet. So here, again, you're going to hold here and just do a few sweeps up and down the quadratus lumborum. So it's just the low back. You're trying to go from the top of the pelvis into about the lower rib area. So you're just a couple up and down and going that way. And then you can move on to the thoracic spine. This is where we're really tight, and so it feels really good to go up and down. And you may have to work it depending on how angled you are as to the length of how much of the muscles that you can target. So this one feels really nice, getting both sides of the spine, the right and the left. And then once you're ready to move up to the top of the shoulders, that's another angle where you're really trying to get your bottom up, and you get the upper shoulders, the traps, and it feels really, really good. The other muscles that are really tight too are the ones on the scapula. So you can roll over just a bit so that you start to get all the stuff that's on the scapula that's really tight and knotted up as well. And that will feel real nice. So you want to do both the left side and the right side. Once you're done with that, then you want to roll on over and you want to work the front of your body. Now, the stomach and the chest are really hard to get to, but you can start with the hip flexors. Those are very tight, and you want to go to the hip flexors right where the quadratus begin over here. And so you're going to go starting at the top, and you can go up and down. Again, just a few inches north and south of the break in where you have your hips flex, the hip flexor. And so you just go up and down there, and then when you're ready to move on to the quads, you go a little bit more to the middle of the leg, going up and then down here. You can focus like I'm doing one leg at a time, but you can also do both legs at a time. That way it's a little more time effective. So again, you're just feeling where are the adhesions and trying to get the blood to circulate here. Now when you go on bone, bone is not comfortable. So you want to avoid the patella. The patella is not very good, but you can also do the shins. The more of the muscle is to the side of the shin, and so you can do that. And you want to be careful with this because again, you have a lot of bone exposed. Then the last one that I do, and I really think this is the most painful one, but also very effective, is the side of your leg. So this is where you want to get into a plank, and so you want to get it so where you're just a little bit lower than where that femur starts, and you can go up and down and up and down. And so you want to brace yourself and get to where you're comfortable supporting your body and allowing as much pressure as you can tolerate here. If it's really painful, then just go ahead and try to do as little pressure as you can. But if you can tolerate more, then really allow gravity to push on you and to dig into the muscle and all around it. So go in a little bit more forward, a little bit more back as you do nice little sweeps along the muscle. Alrighty, so that's a good basic routine. You've got the front and you've got the back, and you want to do that 3 times a week for about 10 to 15 minutes.